So good afternoon, ladies and gentlemen. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar, A Healthy Cervix Starts in the Womb, presented in collaboration with Friends Health Connection. Each year, there are more than 65,000 new cases of uterine cancer diagnosed in the United States and nearly 14,000 new cases of cervical cancer diagnosed. During today's webinar, we will get an overview of the causes and signs and symptoms of uterine and cervical cancer, as well as treatment options and prevention strategies. Our guest today is Dr. Ruth Stevenson, a gynecological oncologist at Robert Wood Johnson University Hospital, Somerset, and Rutgers Cancer Institute of New Jersey. Thank you for joining us. So we're going to begin today's webinar with 20 minutes of moderated discussion, followed by questions and answers from our audience. So if members of our audience do have questions, please feel free today to post them in the chat feature. So first, Dr. Stevenson, thank you again for joining us. And if maybe we can first start by asking you to tell the audience a little bit about yourself.
Sure. So as you had said, I'm a GYN oncologist. So I specialize in the treatment of cancers that arise from the gynecologic organs. So that includes the uterus, cervix, ovaries, and some other rare types of cancers. We train as actually obstetrics and gynecologists. So we do residency training for OB/GYN, and then we do subspecialty training in cancer surgery because we manage and direct both the surgical and medical management of gynecologic malignancies. As you said, I'm at CINJ and also at Somerset Hospital. I am originally from upstate New York. I trained out in California, did some training on the East Coast, and we've ultimately ended up back here in Bridgewater. I've been in practice for over 5 years now, and I just the reason I chose GYN oncology is because I think it's, a unique field where we can affect a woman's life from their diagnosis to survivorship with these malignancies and really develop meaningful and personal relationships with our patients. We're kind of a rare specialty. It's a small community. They only train about 40 or 50 of us a year. But we know that women that are treated by a GYN oncologist have better oncologic outcomes. So it's important, if you do have a GYN cancer, to be seen by a GYN cancer specialist, because we know that that can affect your oncologic outcome. But, I really enjoy what I do, and I'm happy to be at Somerset Hospital and taking care of women there.
Well, we're very lucky to have you, and thank you again for joining us today. So let's start off by giving the audience an overview of the uterus or womb and its function in our body, or the role of the cervix within the uterus. I know that's a lot, but just to kind of start us a little broad before we start to narrow it down.
Sure. So, the uterus functions, its main function is to carry children, right? And so there's really no hormonal function to the uterus. A lot of people ask, if I have a hysterectomy, am I going to go into menopause? And that's not necessarily true, because what's actually making the hormones is your ovaries, which are separate from the uterus. Part of the uterus is the cervix. So the cervix is actually the base of the uterus, or the part of the uterus that kind of holds the baby in during pregnancy. Sometimes we sort of consider it all one organ, but when we talk about cancers that are arising from either the uterus or cervix, they're actually quite different. Throughout a woman's lifetime, getting your monthly period and, other benign conditions can arise from the uterus and cervix. But, the main function of the uterus and cervix is pregnancy. So there's really no hormones or anything that's being made in the uterus or the cervix.
Great. Thank you so much for that explanation. Appreciate that. So now let's talk about uterine cancer. What causes uterine cancer?
Yeah, so, uterine cancer is probably the most common cancer that we treat as GYN oncologists. And when we talk about causes, the biggest cause or driver for uterine cancer is actually excess estrogen. So even though the uterus doesn't make hormones, it's very responsive to hormones. And so any condition or excess estrogen can lead to an overgrowth of cells in the uterus that over time can turn into a cancer. So excess estrogen can often be caused in women who are obese or actually have a lot of peripheral tissue and fat, because estrogen can also be made in your peripheral tissues and your fat cells. And estrogen is also made in the ovaries. So in women that haven't had children or have had conditions or gynecologic conditions that increase estrogen, those women can be at risk for developing uterine cancer. But the biggest driver for uterine cancer, the most common type of uterine cancer, is estrogen. A small percentage of the time, uterine cancers can be related to a genetic disease or a gene that you inherited from your family that increases your risk for uterine cancer or colon cancer, something called Lynch syndrome. But that's typically a very, rare type of cancer.
Oh, okay. Well, thank you. So who would then be at risk for developing uterine cancer?
Yeah. So most uterine cancers arise in postmenopausal women that have completed menopause and still have excess estrogen. We know that the biggest risk factors for uterine cancer are obesity, not having children, diabetes, hypertension, something called metabolic syndrome can all increase your risk for uterine cancer. All of those disease processes increase your estrogen and therefore stimulate those uterine cells that could eventually turn into a cancer.
So now you also mentioned Lynch real quickly. I mean,
Yeah.
Who's at risk for that? Is that heredity or?
Yes.
Yes.
So it's a hereditary condition or a gene that's passed down through families. Now, people that should be tested for the gene are people that may have, because it's also associated with colon cancer, we often screen people who may have family members who had colon cancer in their 40s, or early uterine cancers, or a family member that was tested for Lynch syndrome and is positive, then other families should be tested. It's a fairly rare syndrome, but often, when you're speaking to your physician about a family history and the physician is hearing, okay, my cousin had colon cancer, my mom had uterine cancer, my niece just got diagnosed with an early colon cancer, those would be sort of warning signs to me that we may need to be testing this patient for Lynch syndrome. Now, if someone does have Lynch syndrome, we often recommend what's called a risk-reducing surgery to remove the uterus to prevent a uterine cancer. But often we don't diagnose the genetic disorder until after they have the cancer diagnosis or someone's been diagnosed with a uterine or colon cancer. But again, that typically represents a small percentage of our uterine cancer patients.
Okay, well, and that's good to know, but I figured, let me just ask that question since you brought it up, because I didn't want the ladies listening to go like, oh my God, well, what about this Lynch, what is it called again? Lynch
syndrome.
Lynch syndrome. So
Yes.
Thank you for that explanation. Now, in general, are there any signs and symptoms of uterine cancer? And if so, what are they?
Yeah, so typically abnormal bleeding is the first symptom that a woman will have. So, after the periods stop or after menopause, if a woman notices some bleeding and they haven't bled for many years, then that's kind of a warning sign that they should be seen by a gynecologist and be evaluated. Bleeding doesn't always necessarily mean there's a cancer there, but that's certainly the most common symptom that we see for uterine cancer. In the young women where uterine cancer is rare, sometimes it's the women that have been having abnormal bleeding for many years, abnormal periods, PCOS, history of infertility. Those people also can have some risk factors for uterine cancer, and so abnormal bleeding should be evaluated. You could also have pelvic pain, bladder symptoms, changes in your bowel habits, or other kind of vague symptoms, but typically it's any abnormal bleeding is the first sign of a uterine cancer.
Okay. So now for some women, heavy or abnormal bleeding may be kind of normal. So how do you diagnose uterine cancer?
Right. So we diagnose uterine cancer typically with a biopsy of the uterus. Now that can often be done in the office with a minor procedure, or sometimes it needs to be done in the operating room under anesthesia. But typically, they can be diagnosed very quickly with an office or operating room biopsy of the uterine lining.
Okay. Wonderful. So then, okay, so somebody gets diagnosed. Now, what are their treatment options? It comes back and, unfortunately, they are found to have uterine cancer. What options are available to women these days?
Yeah, so, we're very fortunate to catch most uterine cancers early, meaning often women will say, okay, this period's abnormal, or I started bleeding after menopause. And so most of the time we catch 70% of the time, uterine cancer is diagnosed at stage 1 disease, meaning it's just inside the uterus. And so the typical treatment is for removal of the uterus or a hysterectomy. And we will remove the cervix and also the ovaries at the time of the surgery and sample lymph nodes to check microscopically to make sure that no cancers have spread outside, outside the uterus. Often we'll get some, imaging. But the typical treatment to start is a hysterectomy and some sort of surgical staging. Once, a woman has gone through surgery, then we get a better sense of how advanced or early the cancer is, and we make decisions based on what we found at surgery about if a woman may need additional treatments like radiation or chemotherapy.
Okay, wow. So I guess, can uterine cancer be prevented? And if so, what can women do to prevent getting cancer?
Yeah. So, I think that for the genetic type of cancer, if you have a strong family history or Lynch syndrome, then to prevent a cancer would be to remove the uterus or have a hysterectomy, right? So that's ideal in a small, subset of patients that may have that genetic syndrome. But in the general population, to prevent a uterine cancer, I think a healthy diet, exercise, maintaining a normal weight is a good way to prevent the excess estrogen that can be a driver for uterine cancer. Certainly reporting any abnormal bleeding or pelvic symptoms to your physician can help at least have us diagnose it early or at a very treatable stage. But, in the United States, we're really battling an obesity pandemic on top of the other pandemic that we're battling right now. But a majority of our endometrial cancer patients are obese or overweight, and that may have, caused their uterine cancer. So just, encouraging a healthy diet and normal weight and, routine healthcare screening with your physicians is probably the best way to prevent a uterine cancer.
Great, thank you. So now let's switch gears. So let's talk about cervical cancer. So cervical cancer was one of the most common causes of cancer deaths among American women, but advancements in screenings and treatments have helped reverse this trend. So what causes cervical cancer and who is most at risk?
Yeah, so almost all cervical cancers are caused by the HPV virus, right? And so as you had mentioned, our cancer deaths from cervical cancer, and actually the number of cervical cancers that we have in the United States have gone down significantly because of the pap smear, right? And not all cancers have a good screening test. Like uterine cancer, we don't have a screening test for, but for the cervix, the separate part of the uterus, women get, annual or biannual pap smears to check for evidence of the HPV infection, which is the #1 cause of cervical cancer. We also have an HPV vaccine that's become FDA available in the last 5 years, which is allowing us to prevent the high-risk HPV infections in our young patients. Young women and men are getting vaccinated now, but I think that most people are exposed to HPV at some point in their lifetime, but getting the vaccine and having appropriate screening with pap tests and HPV testing is probably the best way to prevent cervical cancer, because that's the #1 cause of cervical cancer.
Okay. So, similarly, what are the signs and symptoms of cervical cancer?
Yeah, so, we're fortunate in the United States to catch most cervical cancers early, as long as women are going to their gynecologist regularly and getting pap tests. So often there are no symptoms. We may just detect some abnormal cells on a pap smear, but other symptoms can be, back pain, leg pain, abnormal bleeding, pain during intercourse, changes in the bladder function and bowel function. Typically, those symptoms don't present until a more advanced stage. And so, again, because of the pap test, we're able to often catch these cancers or precancer cells very early and treat them before they do become symptomatic. Another big driver for cervical cancer is smoking. And so, when we talk about prevention, I don't know if I'm jumping ahead here, but prevention for cervical cancer, that's my other public service announcement, is that smoking can also increase your risk for cervical cancer along with the HPV infection.
Okay. So again, how is it diagnosed, Jim? I know you mentioned PAP before.
Yes.
So is PAP the only way it's diagnosed, or is there?
So the pap smear is actually a screening test. So that's just a procedure where we take a few cells from the cervix. We also test for traces of HPV virus, and that's our screening test. The actual diagnosis is often made on a cervical biopsy. So after the pap test, if there's concern for either cancer or precancer cells, we typically go to a biopsy at that point, which can either be done in the office or in the operating room, depending on how extensive the biopsy has to be. So typically on biopsy imaging or ultrasounds, like an ultrasound of the cervix probably won't detect a cervical cancer very well. Typically we need the biopsy unless it's a really big cancer or advanced cancer.
Okay, so again, once somebody is diagnosed after a biopsy, and unfortunately if they're diagnosed with cervical cancer, what treatment options are then available for them?
Yeah, so it depends on the stage of the cancer. So if it's an early stage cancer, again, we would do a hysterectomy, and what that does is it removes the uterus and cervix. Sometimes we leave the ovaries if a woman is young or premenopausal, and we would also sample lymph nodes. The type of hysterectomy for a cervical cancer differs from the type of hysterectomy for a uterine cancer because the tumor is actually lower and closer to the bladder and the vagina. So we do what's called a radical hysterectomy for cervical cancer, where it's a little bit more extensive surgery to remove tissue from around the bladder and the ureters and the vagina. But early stage cervical cancer can be treated and cured with surgery. Now, often if a cervical cancer is more advanced and we can't surgically remove it, then women are treated with a combination of chemotherapy and radiation. And cervical cancer actually has a very high response rate to chemo and radiation. And 80% of early stage cervical cancers can be cured with chemoradiation. So that's a really good treatment option often for women as well.
Okay. So my next question is kind of a clarifying question. I think you kind of touched a little bit here and there. So, but what preventative screenings are available, and at what age, and how often should women get them? So I think it's to the PAP, but I just want to clarify because I think you've mentioned pieces here and there.
Right. So for prevention, we recommend the HPV vaccine for boys and girls starting at age 11. It's FDA approved up to the age of 26. So that's sort of the age where people are at highest risk for contracting the HPV virus. So, I think there is some controversy over the vaccine, but we as oncologists all endorse it. It's been validated. I think in Australia, they're now seeing their cervix cancer rates drop significantly since they started vaccinating almost all of their population. So this is actually, a curable disease if we vaccinate the population. So that's the first prevention. Now, as far as screening for pap smears, we typically recommend not starting pap smears until the age of 21. And so the reason for that is even if a young person has been exposed to the HPV virus, we often don't see anything on the pap smear till many years later. So to subject women to, pap smears every year, it's almost been found to be unnecessary until the age of 21. Now, the guidelines have just changed because we're now doing HPV testing, and it's a better test for precancer and cancer cells. We're spacing out the recommendations for women who are low risk to even only get pap smears every 3 to 5 years, as long as they're seeing their gynecologist regularly and they don't have any history of HPV-related diseases. So, I think a lot of women, go to the gynecologist yearly and get their pap smear yearly, and you should still go to the gynecologist every year, but you may not necessarily need a pap smear every year, especially if you're a low-risk patient and have never had any abnormal pap smears in the past.
So, and I'm assuming that your physician would be making the determination of how often you would need the pap or not, correct?
That's right. That's right. Yep.
Okay. So aside from cancer, can you give us a brief overview of some other health conditions that affect the uterus and cervix?
Sure. So, the uterus, you can get all sorts of things that can, kind of cause problems, right? Women can get benign tumors like fibroids in the uterus. You can get polyps, which are like little skin tags that can grow in the lining of the uterus. Because the uterus responds to your monthly hormone changes, some women with, hormone imbalances can either have really heavy periods or abnormal periods. And it doesn't necessarily mean that there's a cancer there, but there could be other benign things going on, like fibroids and polyps and hormonal imbalances that can lead to, gynecologic conditions and issues that may require surgery and things like that. As far as the cervix is concerned, I think that, other than HPV-related diseases, you could also get polyps on the cervix or other benign tumors, even fibroids of the cervix, but those are typically more rare. And, the cervix is, unfortunately exquisitely sensitive to HPV virus. And so we as women, it's difficult for us because HPV is everywhere and can affect any part of your body. But the cervix is typically what we see the most precancer and cancer changes in for any organ in the body.
Okay. So lastly, before I open it up to questions from our audience, what are some tips for women to keep their uterus and cervix healthy? What can they do?
Yeah. So, again, healthy diet and lifestyle, not smoking, being a normal, healthy weight, and undergoing routine screening with pap smears and pelvic exams is probably the most important thing to keeping it healthy. I think that reporting any abnormal bleeding or pain during periods or intercourse or with urination or bowel movements is also very important to keeping, any pelvic organ healthy, but most importantly, your gynecologic organs. And to, report any concerning symptoms to your physician so that they can do the appropriate tests or biopsies or workup necessary to help hopefully catch, anything early if something bad is going on. So.
Great advice. Thank you. So now at this time, I would like to open it up to questions to questions from our audience. If you do have a question, please log that into the chat feature and we will pick up your question to ask the doctor. So why I'm giving our audience just a minute to post some questions. One of the conditions that I don't think I heard you mention was endometriosis. Wondering if you can share with the audience what is endometriosis, again, whether it affects the uterus or the cervix, and does any of those conditions, be it endometriosis, fibroid cysts, do any of them lead to cancer? So
yeah,
that was like a three-part question. Sorry.
Yeah, I think that's a great question. So, endometriosis is a condition where cells from the uterine lining can spread outside of the uterus or to your ovaries, to your cervix, to your bladder, to your bowels. And the most common symptom of endometriosis is pain and painful periods. And it's a chronic condition. It can be a very debilitating condition for women, but it's almost always benign. There are some rare types of cancers that can arise in endometriosis of either the ovaries or other pelvic organs like the uterus. Those are typically clear cell and endometrioid cancers. Those are very rare. But women with endometriosis, because of their pain and, slight increased risk for cancers, they should be, continually evaluated by their gynecologist and, undergo any appropriate workup if there's concern. As far as fibroids go, almost all the time, also fibroids are benign. There are rare types of cancers that can arise in fibroids, we quote that that's about 1 in 3,000. So if a woman presents with, a fibroid in her uterus that may be growing a little bit or painful or causing some bleeding, typically we only find a cancer in those fibroids about 1 out of every 3,000. The risk of a cancer in a fibroid goes up after menopause, or if they're growing very quickly, or if they're bleeding a lot.
Okay. All right, well, thank you. Now we do have a question from our audience member. So should she check with her OBGYN to see if the PAP is checked for HPV? And then how can she get a vaccine?
Sure. So we almost routinely do co-testing now, which means you should be getting a pap smear with an HPV test. So I would certainly ask your OBGYN to make sure that the HPV is also getting tested with your pap smear, because historically we weren't routinely doing it, but now it's recommended to test for HPV with every pap smear. As far as the vaccine goes, right now, I think insurance companies, and because the FDA has only approved it to age 26, women over the age of 26 are still eligible to get an HPV vaccine. But you may have to pay out of pocket, because as far as I know, I'm not sure insurance companies are paying for it. That being said, I've had women over the age of 26 who I'll prescribe the HPV vaccine to, and they can take it to their local pharmacy and have it administered. But they just may have to pay out of pocket, because the studies looking at the HPV were only up to the age of 26, and so therefore a lot of insurance companies aren't paying for it. But it's safe after 26. It's just not approved by most insurance companies for reimbursement.
Okay, thank you.
But I think everyone should get it.
And once again, they get that through their physician, right?
Correct.
Okay. So let me just see if there's any other questions. Okay, last call. All right, well, at this time, we don't seem to have any other questions from our audience. And if that is the case, then this will conclude today's webinar. Please remember, the opinions expressed here by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 1-888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset, please visit our website at www.rwjbh.org/Somerset. Thank you so much for joining us, Dr. Stevenson, and thank you so much to our audience members. Be safe and have a great day.